Good morning, dear students. We continue course of lectures about some tropical infections, and our today's topic is shistosomiasis. Shistosomiasis is infectious diseases caused by a group of tropical parasites with primary lesion of urogenital organs and GAT. The World Health Organization estimates that around 200 million people are infected and 120 million demonstrate symptoms of these infections. Another 600 million people are in a risk of this infection. As fact that malaria only demonstrate more often a rate of meeting in countries with tropical climate. So malaria only have more high rate than, for example, shistosomiasis. Schistosomes are prevalent in outlying city areas of 74 countries in Africa, Asia, and Latin America. In central China and Egypt, the diseases pose a major health risk. Schistosomiasis had been included in the 6 tropical diseases, taking second place in importance after malaria. The first symptoms of schistosomiasis were described in middle centuries in Egypt, the birthplace of schistosomiasis area of the great African lakes. Parallelly with some historical data about this kind of infection, you may suspect photo of these parasites. Here, 2 parasites, more big female and less male kind of parasite. History of scientific describing of this disease start in 19th century. Bilgards opened pathogen of urinary schistosomiasis. At finishing of 19th century, Manson described the causative agent of intestinal schistosomiasis. At 1904, at beginning of 20th century, Katsurada in Japan had found the pathogen of urinary schistosomiasis too. For today, this causative agent classified as causative agent of Japanese schistosomiasis. So what is it? What is it from biological side? It's microhelminthic disease, class Trematoda, family Schistosomidae, genus Schistosoma. There are 5 species of schistosoma what are prevalent in different areas of the world and produce different clinical form and due to it different clinical signs. Area of distribution of these parasites between 38 degrees of northern latitude and 35 degrees of south latitude. So a great area where you may meet this kind of pathogen. Urogenital bilharziasis suspected in 52 countries of Africa, for example, such as Egypt, Angola, Zambia, Nigeria, Tanzania, Sudan, and some others. Classical intestinal schistosomiasis caused with Schistosoma mansoni, suspected in 33 countries of Africa and South America and can infect only human and some rodents. Japanese type of schistosomiasis, named as Katayama fever, is limited by China and Philippines and can infect different mammals such as human, some types of dogs, pigs, prevalent only in the Mekong River in district of Mekong River in Asia. Its significance of real significance of this kind of infection is not very clear due to problems with calculation of deaths what produced with shistosomiasis. Question of realization of complications, it is not acute process, it is chronic process what takes several years, and complications what associated with shistosomiasis cannot be described as very specific. For example, classical complication for intestinal shistosomiasis is development of Simmers fibrosis and portal hypertension. If we suspect Simmers fibrosis around portal vein, morphologically, yes, we may direct to connect directly this mortal case with shistosomiasis. But if in patients suspected shistosomiasis and portal hypertension, so is it portal hypertension produced with and due to shistosomiasis, or for example urogenital shistosomiasis, very often complicated with development of hydronephrosis due to sclerotic changes in urinary bladder, increased pressure inside urinary bladder. It provoke reflux of urine to the kidney. Due to it, more simple realization of pyelonephritis, and due to it, more often formation of stones in urinary waves, and due to it, more often formation of hydronephrosis. But to say directly is it really associated with shistosomiasis or not is very difficult. Due to it, we can't to say how many deaths provoke with shistosomiasis. Next problem. Shistosomiasis spread in countries with tropical climate. Not at all cases of countries with tropical climate we suspect and may speak about good level of medicine, and due to it, not at all cases in people what die with shistosomiasis we can get results of autopsy. Without autopsy, we may prognose or say what is possible reason of death, and due to it, again, troubles with statistic. For example, patient died due to chronic insufficiency. If will be autopsy, in this situation, we may associate with chronic kidney insufficiency with shistosomiasis. In time of autopsy, for example, we reveal chronic shistosomiasis, and based on it, to build logic schemes that really shistosomiasis provoke in this patient, for example, hydronephrosis, and due to it, we suspect chronic insufficiency of kidney, renal failure. But if this procedure absent, people die due to kidney disease, urinary shistosomiasis was not diagnosed, or patient thinks that he recovered after shistosomiasis, after primary signs of shistosomiasis, what was 10-15 years ago, and due to it, possible mistake. Due to it, we can't say exactly about mortality due to shistosomiasis. Generally low, around 2-3 cases for 100,000 deaths. It is very few for this infection. Must be more. Here photo of pathogen, practically same for different kind of it. More big worm, lower worm female, upper worm male parasite. So it's for adult worm. Source of infection. Practically all kind of shistosomiasis belong to anthropozoonotic infections, because source of infection as human as some kind of animals. For example, for intestinal shistosomiasis caused with Schistosoma mansoni and intercalatum, source of infection are human, rats, monkey. For Japanese type, additionally to standard variants, large and small cattle. Schistosoma mekongi, little less. Man and human and dog are source of this infection. What is good in today delivering? A lot of clinical forms, but most part of clinical signs will be same. Practically all early stages before typical chronic late stage of this infection, clinical signs will be same. All 5 species are transmitted with same mechanism of transmission, percutaneous, through direct contact with fresh water, what was infected with free-living form of this parasite. Free-living form of this parasite named as Cercaria. Who will have risk of this? Who will have risk of this infection? Who work a lot of with fresh water, especially if this fresh water are possible polluted with urine or feces. So cycle of development. Eggs are excreted in human urine or feces, depend on type of shistosomiasis. Eggs break open in water and release the form of a parasite what named as miracidium. This form, miracidiums, go to freshwater snails. Freshwater snails become infested with miracidium. Miracidium multiply inside the snail and mature into multiple cercaria, what the snail inject into the water. So first stage egg, after that miracidium colonize snails, multiply, transform to cercaria. Cercaria come out from snail, and this cercaria, it is free living form, may survive outside of host for 48 hours, and if will be contact with next host, for us more interesting human, may penetrate through non-damaged skin and mucous membrane to the human body. Inside the human body, the worms penetrate the wall of nearest veins and travel to the liver. There will be a next stage of development and sexual maturation of these parasites. After that, male and female worms migrate to GIT, to the intestine or to the urinary bladder, where will be intensive production of eggs. where will be intensive production of eggs of this parasite. One female worm may produce from 200 to 2000 eggs every day in average in time of life. How many it may produce eggs? Minimally, several of minimally for 40-45 days. Some of eggs are not excreted. Some of eggs will not excreted. Most part of eggs leave the bloodstream and body through the intestine. Some of eggs not excreted and accumulated in tissues. And this situation, accumulation of these eggs, practically is morphological background for realization of disease. So on this picture you may suspect a cycle of development, what I described before. Here it's described with help of picture. Here illustration of a cycle of development for urinary shistosomiasis and for intestinal and Japanese shistosomiasis too. Adult parasites don't come out from human body from penetration of Cercadia to releasing of eggs, as I say previously, minimally 1 month, I make mistake, 30-45 days. A group of risk, as I say previously, people who work a lot with fresh water, especially if with fresh water, without guarantee that it is really clear. Who are it? Workers of rice and sugar plantation, workers of irrigative system, fishers, they are all in group of risk of transmission. Intensity of transmission will depend on concentration of parasites, will depend on type of parasites, susceptibility of the host, and and power of immune system of the host, of course. Immunity non-sterile. About our human pathogen, immunity non-sterile invention is not self-limiting. Main reason of the development of immunity: major parasites, products of their metabolism, membrane proteins, and eggs. Antibody can't to destroy adult worm, but affect schistosomala. Schistosomala, it is granuloma tissue with inflammation what will formate around worm and around eggs what was not released. And from one side it will associate it with local troubles, damage of tissue, sclerotic changes of tissue, what is not very wonderful if we about big veins, intestine or urinary bladder. It will create disturbance of function of these organs, but it stop and prevent superinvasion. It stop and prevent superinvasion. Pathogenesis of this infection. So what we suspect, first of all, allergic reaction. Allergic syndrome is very typical for this kind of infection. Why will develop allergic reaction, allergic syndrome? Due to sensitization of organism with toxic products of schistosomala and Cercadia. Next, migration of eggs through the vessel wall of the bladder and intestine, in liver, lungs, maybe in brain, in some organs, will be accompanied with development of granulomas. So will be local inflammatory and allergic process, and this process will finish with fibrosis. About it I say a little previously. Proliferation of connective tissues of blood vessels lead to the development of obliterated endarteritis in the liver. A finishing of this process will be formation of portal hypertension and ascites. Result of ascites you may suspect on this slide. It's visual result of ascites. A result of portal hypertension will be liver cirrhosis and, of course, chronic liver insufficiency. Damage of pulmonary vessels will provoke hypertension in system of lung artery, and due to it formation of pulmonary heart with chronic heart insufficiency. Migration of aches in system of portal veins promote proliferation of the connective tissues around the portal vein, varicose vein of esophagus, and development of portal hypertension. Here maybe not very so practically repeating of previous position, little other reason of development of portal hypertension. Look, first, troubles with arteries. Due to bad perfusion through the liver, obliterated endarteritis will provoke bad perfusion through the liver, will be formation of cirrhotic changes because change of functional tissues for sclerotic change in case of serious hypoxia typical. So first will be formation of fibrosis. And fibrosis and cirrhosis of liver may provoke portal hypertension. But it was not enough for this kind of disease. Additionally, aches directly migrate to system of portal veins and block portal veins not from internal side, from external side. Connective tissues as ring press for the portal vein, and due to it additionally formate portal hypertension. So patients with untreated intestinal shistosomiasis have a lot of chances for formation of portal hypertension, bleeding from varicose dilated veins, and deaths due to hemorrhagic shock or due to chronic liver insufficiency. Practically, I don't know why, maybe some troubles with today's presentation. Here not described some positions about urinary shistosomiasis. In first two positions in pathogenesis typical as for urinary as for intestinal shistosomiasis. For urinary shistosomiasis, this position about proliferation of connective tissues of blood vessels play a big role, and for urinary bladder, and migration of aches will provoke proliferation of connective tissues of in urinary bladder. Due to it, urinary bladder work abnormally, due to it, reflux of urine, due to it, hypertension in urinary system, and due to it, more simple realization of pyelonephritis and more simple realization of hydronephrosis with chronic kidney insufficiency. Next, clinical classification. Clinical classification of this infection include the stage of infection, first stage penetration and migration, second stage of maturation, third stage of impending invasion, fourth stage of late invasion. Practically, two stages are same for all types of shistosomiasis. Incubation is long, from 4 to 16 weeks, from 1 to 4 months. First stage of infection, penetration, take 5-7 days clinically. And here troubles, because to clinical stage it will belong in one situation only if it will be reinfection. Because if it is primary infection, it will be asymptomatic. In case of reinfection, we may suspect signs of acute dermatitis, acute and allergic dermatitis with itching, erythema, and maybe some other signs of moderate allergic reaction with weakness, mild increasing of body temperature, in rare situation, fever. Migration. After penetration through the skin, will be migration up to 2 months. And here mostly we may suspect signs of allergic syndrome. For example, leukocytosis, eosinophilia, increased ESR, eosinophilic infiltration in lungs, liver, and in other internal organs. May be suspected lymphadenopathy, decreased appetite, headache, may be signs of obstructive bronchitis. So there are signs what are typical for different type of helminths in stage of migration due to powerful allergic reaction. Stage 2, stage of maturation for Japanese type of shistosomiasis, 4 weeks, for intestinal Manzoni shistosomiasis, 5 weeks, urogenital take from 8 to 10 weeks. Clinically, so I remind that for maturation, come to the liver. High temperature with eosinophilia, headache, weakness, losing of appetite, abdominal pain, nausea, diarrhea, allergic rash, may be a realization of Katayama syndrome for Japanese shistosomiasis, eosinophilia, splenomegaly, allergic rash, and all of it associated with absence of eggs in stool. I remind that it is stage of maturation and worms not migrate yet to place of final multiplication. So what's the difference? Stage of penetration, migration, and stage of maturation. Here, stage 1 less severe and mostly associated with some skin involvement with acute dermatitis. Stage 2, severe allergic reactions, high temperature, eosinophilia, and peer intoxication. The stage of impending invasion take from 3 to 7 years. Common for all type of shistosomiasis. Will be intensive production of eggs in place of parasiting and discharge with urine and feces. Development of destructive reaction, local focal necrosis, exudation, eosinophilia around eggs with subsequent proliferation. Due to this local necrosis, exudation, eosinophilia, and subsequent proliferation, will be damage of blood vessels, possible inflammation of blood vessels, development of vasculitis. In severe cases, it will be associated with thrombovasculitis and may be thrombosis. So, more for intestinal schistosomiasis. Characterized with lesion of large intestine, eggs pass through the wall. There will be suspected damage of liver and spleen too. Stage of impending invasion. Clinically, on symptomatic level, pain in abdomen, frequent stool with admixture of blood and mucus, maybe tenesmus, meteorism. Due to chronic inflammation and proliferation will be formation of polyps of colon. Clinically, it will be associated with pain, partial or total obstruction of intestine, losing of body weight. I remind that polyps in colon are mostly pre-cancer disease, so it is not obligatory, but possible from that this kind of infection will play a role as pre-cancer disease because it will stimulate formation of polyps in the colon, and due to it may be a malignization of this process. Affection of liver and spleen associated with drift of eggs and formation of granulomas around it may be on symptomatic level described with heaviness in epigastrium, hepatosplenomegaly, hyperproteinemia, increased ALT, and development of anemia. In rare cases, suspected defeating of spinal cord with development of paraplegia. As allergic complications, what not directly associated with this disease, may develop glomerulonephritis. Mostly, I say about chronic kidney insufficiency in connection, in association with urinary schistosomiasis, urogenital schistosomiasis. But due to powerful allergic reaction, may be formation of glomerulonephritis as complication. And due to immunosuppressive activity, due to immunosuppression, of course, may be realization of pneumonia, especially if will be formated chronic bronchitis or bronchial asthma as a result of, again, allergic reaction. And again, here appear question, here I may put the question about mortality. For example, you know that untreated bronchial asthma is very dangerous for the people and may provoke asphyxia, may provoke severe hypoxia and death of patient due to hypoxia. And for example, patient due to schistosomiasis start to be ill with bronchial asthma, die due to bronchial asthma. So is it mortality of schistosomiasis or it is mortality of bronchial asthma? It's very unclear question, and for today we can't to say how many serious complications was provoked with this kind of helmets, microhelmets, of course. Next, stage of late invasion. Stage of late invasion here will be suspected Simmers fibrosis, fibrosis around portal vein, signs of chronic liver insufficiency, signs of chronic portal hypertension, polyposis of the colon, maybe kidney damage, but all in chronic and mostly decompensative stage. Edema of lower extremities, ascites, it is as signs of decompensation of liver functions. Japanese shistosomiasis. What we made to say, what's the difference with classical intestinal shistosomiasis? More bright clinical picture, more acute clinical picture. Due to what? The worm produced maximum number of eggs, more than 3,000 daily. Necrosis, what finished with fibrosis, prevails in granulomas. Fibrosis of the liver develop very often, if of course not treated. Drift of eggs in nervous system activate development of hepatocerebral encephalopathy, acute and chronic cerebral form of psychosis. So Japanese shistosomiasis, more malignant variant of shistosomiasis, if usual intestinal shistosomiasis is associated with development of liver cirrhosis, fibrosis of Zimmer, Zimmer it is family. With development of allergic complication here, additionally may be realization of damage of central nervous system. What specific of shistosomiasis mekongii, what suspected mainly in Mekong River district, very often related bacteremia as complication of shistosomiasis. Additionally, more often with salmonella. So I think that it's due to quantity of carrier state, mostly maybe in this district in increased rate of carrier state. It is not impossible for other type of shistosomiasis. I don't see why it's not possible for other type of intestinal shistosomiasis. But for shistosomiasis mekongii, bacteremia caused with salmonella realized more often than for other cases. Laboratory. What we made to do. I am sorry, before laboratory, I repeat that today we have some troubles with urinary shistosomiasis. So late stage of urinary shistosomiasis will be associated with realization of chronic cystitis, polyposis of urinary bladder, cirrhosis of urinary bladder, chronic pyelonephritis, stones in urinary ways, and hydronephrosis. What is more bright clinical picture? More bright pyelonephritis as realization of chronic inflammation and reflux in urinary ways. In stage of impending invasion, in patient with urinary shistosomiasis suspected hematuria due to what? Parasites migrate to urinary bladder, release eggs. Eggs pass through the wall of urinary bladder to the urine, release with urine, but it provoke so named terminal hematuria due to bleeding from urinary bladder, and result of it will be terminal hematuria. More bright clinical signs of this infection, terminal hematuria. After that, it may after several months it may disappear. After that, formate late stage of infection. Laboratory diagnostic of different type of shistosomiasis. First of all, it is microscopic detection of eggs in urine or in feces, of course. Less possible finding of it in sputum, liquor, in semen. More typical finding of it in urine and feces. Maybe larvoscopy. After incubation of sediment, urine or feces with water. So I remind for you that from eggs must to release miracidium, what have motile activity. So if you not reveal eggs, may mix urine with some amount of water, wait several hours and repeat microscopic examination. Maybe you find intermediate form of this parasite. In case of urinary shistosomiasis, will be necessary to make cystoscopy. Why necessary to make cystoscopy? Because polyposis, it is pre-cancer disease, and of course presence blood in urine, of course, you must make differential diagnosis with cancer. If you work in normal hospital, this situation stay more simple for you. You may forget about this infection and to put diagnose logically. Due to what? Inpatient suspected terminal hematuria. Terminal hematuria does mean something wrong with urinary bladder. Due to it, you make ultrasound of urinary bladder, reveal possible polyposis. Next step in diagnostic will be cystoscopy with biopsy. And cystoscopy with biopsy reveal that it is not simple polyposis, it is chronic urogenital shistosomiasis. Same endoscopic examination of intestine in case of intestinal shistosomiasis. Very often intestinal shistosomiasis will be associated with chronic intestinal bleedings. Necessary to make, in this case, necessary to make differential diagnostic with cancer. And of course, in this situation, you can't to stop your diagnostic procedures before endoscopic examination of GAT with biopsy. And of course, in this situation, you may forget that was delivering of some tropical infections such as shistosomiasis, what may be associated with polyposis, allergic reactions, intestinal bleedings, but in patient present chronic intestinal bleedings, here necessary to make differential diagnostic with cancer, and biopsy may help here to put diagnosis. Of course, diagnosis may be put more simple with usual microscopic detection of eggs in urine or in feces. But not at all cases it works good, and not at all cases you will remember about this situation as tropical infections. If you work somewhere near tropical countries, or you work in tropical countries, of course you will meet this kind of infection more often, and diagnostic of it will be simple for you. But in situation where when patient returned from tropical district several years ago and ineffectively treated, for example, in tropical countries, here patient may not inform you about visiting of tropics, and of course may be some variants of diagnostic mistakes. Supportive methods, what may be used, it's clinical method X-ray of urinary bladder, X-ray of lungs. In urinary bladder may be revealing of calcinates. In lungs may be revealed eosinophilic infiltrates. In unclear questions may be used laparoscopy. Not only endoscopy, may be additionally using of laparoscopy. For immunological stage on early and late stage of infection, may be using of serological methods such as ELISA with revealing of G and M class of antibody, mostly as will interest in M class of antibody. Please remember that here serological diagnosis may be not so simple as we want usually. I think you know well that in case of ELISA we may to put diagnosis of infection when we suspect M class of immunoglobulin. But M class of immunoglobulin is typical for acute infection or acute stage of infection. In case of shistosomiasis, we work with chronic infection, so we will suspect both type of immunoglobulin, G and M class. And amount of M class of immunoglobulin will be not very high due to two positions. First of all, this kind of immunoglobulin will be used in reaction in immunocomplexes reactions. Second, every helminthic diseases and shistosomiasis provoke mild moderate immunosuppression. So what must be done if we reveal only G class of antibody and not reveal M class of antibody? Necessary to check affinity of antibody. If affinity is high, it is with very high chances immune memory that patient had at last this infection but recover. If affinity of G class of antibody is lower, less than 50% usually, for this situation necessary to think about chronic infection. Patient not recover, he have chronic infection, chronic stage, silent stage of this infection, but he is not recover after this infection. In this situation it is not immune memory. The reaction Complement fixation test, reaction of hemagglutination, or some other tests what help to reveal types of antibody. Titer of antibody here are usually necessary to check titer of antibody twice, because usually, as I say previously, we work with chronic infection, and titer of antibody maybe not very high for acute stage. If titer of antibody not very high, so check antibody twice. If titer of antibody stable, in this situation, you may think about immune memory. If titer of antibody very high, if titer of antibody is very high, in this situation, you may put diagnosis of infection. Here examples of etiotropy, table of examples for etiotropic treatment. As you understand from my previous long speech, main trouble for shistosomiasis, it is diagnostic. If you put diagnosis, you may use, for example, praziquantel in dosage 40-60 mg per kg in once, and it will help with all type of shistosomiasis. So you put diagnose, you choose remedy, you prescribe it once, and patient start to recover. Maybe used Bilarcil 10 mg per kg for urinary shistosomiasis, maybe using of some other remedies what you may suspect in this table, such as entrinol or some other. In last years, increased rate of using of Bilarcil, Biltricid, and some other antihelmintic remedies. Prevention for all kind of shistosomiasis is not very hard from one side, from side of strategy, from side of theory, and very hard from practical side, because necessary to follow to sanitary hygienic measures. Sanitary hygienic measures mostly associated with level of economic development of country. Must be used individual prevention, such as protective clothing at risk groups in people who work a lot of with fresh water, and especially polluted fresh water. Struggles with intermediate hosts, such as snails, chemical and biological methods. Maybe using of ecological methods, such as change of environment. Again, it's cost a lot of, and of course some poor countries without help of other countries can't to use this method of struggle, can't to use this method of prophylaxis, and due to it we continue suspect that half billion of people, in more than half billion of people, live in risk of this infection. Sanitary hygienic measures on improvement of settlements. Fresh water. What we made to say that clear fresh water is a dream for a lot of countries of the world. So it is not decided well on surface of all our planet. Health education of population. I think that necessary to say not about health education, necessary to say about common level of education. Uh, because it is, I think, not health education, it's common education that you don't must to swim in dirty, in polluted water or some other. Sanitary supervision over natural sources of this infection. Again, one wonderful idea, but not at all countries of tropical zone it is possible due to again troubles with healthcare system and troubles with economic commonly. As a resume, all these methods belong to non-specific methods of prophylaxis. We haven't for today vaccine for different kind of ailments, and we haven't specific prophylaxis, specific immunoglobulin or specific vaccine for shistosomiasis too. What in real life necessary to diagnose this kind of infection so fast as it possible and treat people on a more early stage. As you see, if people will be treated before late stage of infection, prognosis will be good. If people will be treated for the late stage only, then will be finished formation of liver cirrhosis and portal hypertension. Of course, etiatropic therapy little improves situation with complications what was developed in result of shistosomiasis. Yes, little improvement will be, but chronic liver insufficiency not decrease after the etiological treatment of shistosomiasis. So necessary to diagnose these infections before realization of chronic liver insufficiency, before realization of fibrosis and cirrhosis of liver, and before chronic pyelonephritis and hydronephrosis formation for urinary shistosomiasis. Are all cases finish with this scheme with formation of liver and kidney insufficiency? No, I think all depend on immune system of patient, some genetics factors, and level of invasion. And of course type of invasion, for example, Japanese shistosomiasis is more malignant than standard intestinal or urinary shistosomiasis. Of course, possible that some people recover and without our help. But in each case, chronic inflammation here with sclerotic changes, with focal immunosuppression, with focal inadequate activity of immune system, it's precancer background. Polyposis of urinary bladder or polyposis of intestine, it in each case risk of cancer occur. This does not mean that shistosomiasis is strictly associated with cancer, but in each case, chronic stage of shistosomiasis increase rate of cancer. Due to it, these diseases must be treated and treated on early stage if it possible. If it is not possible, of course, must be treated for late stage too, but parallelly with late stage, great significance will play symptomatic therapy, such as therapy of portal hypertension, therapy of liver cirrhosis, and or therapy of chronic kidney insufficiency. And in each case, it costs more than single using of praziquantel. That's all what I wanted to say for today about shistosomiasis. Topic is not very big. I deliver without long break for today, and for today I stop my delivering about tropical infection. Thank you for your attention, and we'll meet it in time of practical classes.